More and more people getting vaccinated against COVID. There are more stories emerging about side effects, especially after the second dose of the vaccine. Here to talk about those side effects is Keith Grant, Senior System Director of Infection Prevention at Hartford Healthcare. Welcome back, Keith.
Hi, guys. Welcome. Thank you for having me.
Thanks for being here. All right, some people are reporting some notable side effects, mostly after the second dose. What are you seeing?
Yeah, and which is consistent with the trials, like both the Pfizer and Moderna trials. We saw at least 80% of both trials had some form of localized side effects, such as pain at the site, some swelling, probably some redness as well.
All right, why do some people have no effects and others have others? Does it have any bearing or not if the vaccine is working?
No. It definitely don't. And again, this is very consistent with the trials and very consistent with what we're seeing nationally and globally. We see some individuals that have absolutely no impact from the second dose. And we've seen a number of individuals, on the other hand, having impacts. But we do know within the trials is exactly the same, and the efficacy as reported, by the Pfizer and Moderna, over 94% for efficacy. So absolutely no difference.
All right, what happens to the body after the second dose?
Yes, and that's a good question. So what we expect is the first dose introduced the actual, the virus in a sense, wherein it introduced the ability for the body to create that antibody. So by introducing that spike protein through the mRNA technology, the body responds by creating the antibody. And when the second dose comes in, at that point in time, the antibody is already present. So the body responds by creating even more antibodies, but also systemically responds by trying to fight the actual virus itself, or what it recognized to be potentially a viral infection. And this is the reason why the expectation on the second dose to have some more of a reaction and some more side effects.
All right, what do you recommend people keep in mind before or after receiving the vaccine?
One of the things that we've said in multiple forums is keep educated, right? So expect generally to have some form of side effects. So pain at the local site of the actual injection itself. Fever is not uncommon. The expectation is within a day to 3 days, all this should really subside. And if anything persists, get it reported as soon as possible and get checked out. And it is perfectly fine to, your Tylenol or your ibuprofen as per recommended. It's perfectly fine to use that to help to mitigate some of these symptoms as well.
All right, Keith Grant with Hartford Healthcare. Thank you once again for being with us.
Absolutely. Thank you for having me.
Thank you.